Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about a quick 10 to 15 minute routine of exercises for range of motion and blood flow and muscle contraction that you can all perform in a seated position. Hi everyone, so today we're talking about and demonstrating a quick kind of routine that I like to use for seated exercises for the legs, the lower extremities. Not necessarily a super intense routine, not necessarily a super challenging or strength building type of routine, but just something that is good for muscle contraction, working on range of motion a little bit, getting your blood flow, desensitizing, just moving the body a little bit. A quick 10-minute routine kind of works all different parts of the legs and is just helps keep you moving, helps keep blood flow, and helps manage pain and stiffness as well, I've noticed. So first we're going to start from the bottom and work our way up. So we're going to start with ankle pumps. So just pumping the ankles up and down. With all these exercises, you want to have good posture. I like to have my patients and clients sit up at the edge of the chair so they don't have that tendency to just slouch back like this. I want them to be sitting up, active, have their trunk muscles engaged and have them engaged in the exercise. So do ankle pumps. I like to work up to 20 or 30 repetitions, trying to do both sides with all of these. You can also do this one where you're doing more of a heel raise or a calf raise, doing 20 or 30 repetitions that way as well. The next one, we're going to work up to the knee. So we're going to do some seated knee extensions, also known as long arc quads, trying to really focus on controlled motions, both with the up and the down portion. You can alternate side to side. You can do sets of 10. You can do all on one side, all on the other. Really doesn't matter, just that you're getting in some good repetitions. I like it to, again, do 20 to 30 reps. Focusing on getting that full range of motion, really squeezing at the end to get that full knee extension, that full knee straightening. So do 20 to 30 repetitions of that. Then you're going to move on to do some knee flexion or bending. And we're going to do that with heel slides. So sliding the heel underneath you and back. If you don't have a surface that slides well, you can get like a furniture slider, works really well. If you have like a glossy magazine cover, sometimes people use like a grocery bag and put a grocery bag around the foot, and that seems to slide really well, like a plastic bag. You can be creative, find ways. Again, you can alternate, you can do all on one side. This one you have to start with, better to start with the leg out a little bit. Again, don't have to really crank on it, don't have to go super intense into your maximum bending, just trying to get some blood flow, get some motion going. 20, 30 repetitions on each side. Moving on from there, we're going to go up to the hip now. So a nice and easy one, doing some marches or hip flexion. I like to really alternate with this one, but again, you can do all on one side if that's what you prefer. With this one, as well as the knee extension, you can of course add some ankle weights, add some resistance, make it a little bit more of a challenging, strengthening type of exercise. If you do that, just make sure that you're really focusing on good technique still. Very easy to compensate with a lot of these exercises. So if you do add some resistance, or even if you don't, make sure you're still focusing on nice controlled movements, good technique, full range of motion. That's the marches. Next one I like to do are some isometric hip adduction, so squeezes. So I have a rolled up towel. You can use a pillow, you can use a small ball, whatever you have available. You're gonna put it between your legs, still sitting up with that good posture. Squeeze, hold for maybe 3 seconds, and then relax. Squeeze, and then relax. I say 3 seconds. You can hold it as long as you want. Sometimes people have the tendency to do these really quick squeezes and you don't get that benefit of that prolonged contraction of those muscles. So I like to hold for at least a count of 1 1,000, 2 1,000, 3 1,000, and then relax. Again, trying to get 20 to 30 repetitions total. You can break it up into sets if you have to rest a little bit, but trying to get 20 to 30 repetitions. And then after that, we do the hip abduction, so bringing the knees apart. I like to use some resistance with this one just to get a little bit of that engagement of those muscles. You can get a TheraBand loop like I have. You can use just a normal TheraBand and get it maybe from your physical therapist, or your trainer might have it, or you can order some yourself. Relatively cheap, and just tie it in a knot as well. That works too. And we're pulling the knees apart, so you can do it with the feet together. That's going to give you a little bit more external rotation, so some rotation outward of the hip when you do it. Or you can start with the feet about shoulder width, hip width apart, and then do the hip abduction from there. Again, slow and controlled, trying to get maybe 20 reps, 30 repetitions. So that's kind of the whole routine. And then I like to finish it off with one more exercise that's not necessarily a seated exercise, but I like to just do some sit to stands up and down. Again, just like all the other exercises, nice and slow and controlled. You can do hands across your chest. You can do hands on the thighs, gives you a little extra push. Or if you do need to use that, the arms to give you a little extra assist, that's okay too, of course. But trying to get maybe 20 repetitions, 30 repetitions. I like to break these ones into sets of 10, rest for a minute or so, and then do the next set. So just a quick review. Again, this is a great, quick 10-15 minute routine depending on your pace, just to really start to work on range of motion, activating the muscles of your legs, getting some blood flow, getting some muscle contractions, and helping to kind of desensitize your legs and your knee to movements, help to decrease some of that pain, decrease some of that stiffness, and make your body more comfortable with some of these movements. So we had the ankle pumps, both toes up and down, and then heels up and down. We had the knee extensions or knee straightening. We had the heel slides, bending back and forth. We had the hip flexion or the marches. We had the hip adduction, the squeezes, and we had hip abduction with the band. And then last but not least, some sit to stands. So that's my quick 10 to 15 minute seated exercise routine. I hope you got some useful exercises, a quick routine that you can do if you're sitting at work, sitting at your desk, watching the commercials on TV, whatever it may be. Just a really quick, easy routine to keep your body moving, keep your legs and muscles moving, and help with some blood flow through those legs. Thank you very much for watching. As always, please be sure to subscribe so you can catch all of our videos. We talk about everything related to knee replacement surgery, preparing, recovering, the surgery itself, frequently asked questions, whatever it may be. We post videos every day on all sorts of different things and topics. Thank you very much for watching. Please leave your feedback, your questions, and I try my best to reply to everyone. Have a great day.